Good morning. I'm Dr. Deuk Majan, CEO and founder at Deuk Spine Institute and Deuk Joint Institute. I'm here with a lovely patient who traveled all around the world, as a matter of fact. We were just talking about her travels with her husband. But she came here for neck pain, and it turned out she had neck pain coming from her facet joint. She has arthritis in the facet joints in her neck, really mostly on the right side, and we diagnosed her with cervical facet joint syndrome as the cause of her neck pain. Cervical facet joint syndrome is the second most common cause of neck pain, and it was her cause. She also had on the MRI degenerated discs, bulging discs, herniations, stenosis, but none of those needed to be treated because they were not causing her symptoms. So we diagnosed her with facet joint pain, and she underwent the Deuk plasma rhizotomy for the cervical facets yesterday. You can see we went in and destroyed the pain nerves, and that's a permanent fix for her neck pain. Do you still have your neck pain today?
No, it's gone.
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 Awesome. Still have some stiffness, which will take time to go away.
It's a little, yeah.
But the pain is gone. And how do you feel about that?
Fantastic. Yeah.
Good.
I want to be able to go away. I felt I couldn't. I thought this could happen at any time,
Mm-hmm.
Now I feel free.
When did you notice your pain was gone?
When I woke up yesterday.
From the anesthesia?
Yeah.
How was the anesthesia for you?
That was amazing. I didn't know anything. I just went into the operating room, and the next thing I knew, I was awake and really awake. I didn't feel like I'd had an anesthetic. Very happy about that as well.
Well, you have one of the best anesthesiologists in the world. Dr. Berndes was your anesthesiologist. He did a great job.
Yes, he did.
You happy with your experience?
Yes, yeah,
All
very,
right.
very.
What was life like for you before you had your cervical Deuk plasma rhizotomy?
Well, I never knew how the pain was going to be. Some days were a lot worse than others, and it was in different places, and, I couldn't get on with my life. I couldn't do housework and lots of things. Just it affects everything, your shoulders, your neck, and it was not good. And now I feel happy.
Good. Well, you traveled from the other side of the state of Florida. And why did you choose Deuk Spine Institute? Why did you choose this surgery?
Because when I was having my worst attack ever, and I was stuck in the house for 5 weeks, laid up on my back most of the time, I was just checking my phone constantly, and I found you. And I thought, that's for me.
Good. You liked the fact that it was minimally invasive?
Yeah.
Just a 4mm incision, no bleeding, no hospital, just a quick recovery overnight. Well, anything you want to tell your fans out there?
I'm not very good at this.
No,
I'm shy.
you're doing great.
It's shy.
You're doing great.
I'm just the happiest person in the world, and I can't wait to book hot vacations and things, and not be thinking, oh, will I be having an attack, and will I be able to go? And I want to go and see our kids that live in the UK, and I feel free to do it now.
Where do they live in the UK?
The Bristol area.
Okay.
Southwest.
Southwest. Okay. Congratulations. Enjoy life.
Thank you.
You're welcome. All right, let's get you out of here.